Well, earlier this month, Haley Erbert Huff, Derek Huff's wife, made headlines due to an emergency medical diagnosis. She was diagnosed with a cranial hematoma from a burst blood vessel. It required emergency surgery. A hematoma happens in up to 25% of people with head injuries. And here to talk more about this is Dr. Brian Snelling. Thank you so much for stopping by with us. So number one, explain to us what the condition is. I heard of it. I didn't necessarily know what it is. So in layman's terms, talking to people at home, what happens here?
Sure. Cerebral hematoma. Cerebral just means the brain. Hematoma means a blood clot. So there's a blood clot either in or around the brain, and your brain sits inside the box of your skull, and there's not a lot of room, and so there's some swelling, and when that happens, patients can become very sick, and they need surgery to remove that and to allow the brain to resume its normal position.
Okay, and when we talk about Haley's case in particular, it's interesting because she's only 27 years old, very young when it comes to this, and normally, like we said earlier, it's usually with head injuries. So what do you think happened here? A lot of conjecture maybe, but...
Yeah, I certainly think it's conjecture. Usually in younger people, when they have blood clots, hematomas in and around the brain, that's usually from trauma, a motor vehicle accident, a fall. Other times it can be due to things such as blood vessels that can burst in the brain, aneurysms, other blood vessel problems of the brain that can cause bleeding. And then again, that bleeding, it starts to push on the brain. The brain doesn't like that very much, and then eventually you need some sort of neurosurgeon to go in there and do surgery and help the brain out.
One can assume this is a very serious thing to happen. How severe is it when it happens? We know that Haley, for example, got a craniectomy.
Yeah.
That's a surgery. What are we talking about here when it happens and how the survival rate is?
Yeah, I mean, it's not only serious, but it's time dependent. So when people have these sort of issues, surgery has to be done swiftly and it has to be done effectively. So in her case, if she had a craniectomy, what that means is part of the skull was temporarily removed to remove that blood clot. Sometimes that bone is replaced, sometimes it's not, to actually allow the brain to swell, to give it some room. So it's hard to say whether that was done in her case. But yeah, time is of the essence, and really it's just the most important thing is getting to a place that can adequately diagnose you and treat you as quickly as possible.
Right. Okay, so for someone listening at home, are there any type of health problems that lead to this? Or, if you have a certain health condition, should you be more on the lookout for it?
Yeah, so I think for someone who's young, the most common thing would be a trauma, right? So simple things: wear your seatbelt. Don't do anything dangerous that would put you at risk of having a fall or a motor vehicle accident. For other people, what can set you up to have these type of problems? It's usually people on blood thinning medications. So if someone's put on a blood thinning medication for their heart, or they're put on a blood thinning medication to prevent having another type of stroke, certainly those medications can put you at a higher risk from having bleeding on the brain, even from something as minor as bumping your head or having a mild fall or something like that.
And we just had some tips there to make sure to ensure brain health, limit alcohol intake. What other takeaways for people at home?
Yeah, I usually tell people the same things that are healthy for the blood vessels of the heart are healthy for the blood vessels of the brain and healthy for the brain itself. So limit alcohol use, don't smoke, make sure your cholesterol and blood pressure are controlled, exercise and weight loss if you're overweight. All
right, well, such a good thing to highlight here. We appreciate it. Good to learn about new conditions and what to be on the lookout for. So if you're listening to this and want to learn more about it, we've linked all the information on our website.